Mental Health Monday on Radio City Talk. Tackling the stigma.
Mental Health Monday here on Radio City Talk. And this Monday, we're going to talk to the Samaritans. And I'm very happy to say that from the Samaritans in Liverpool, David and Rachel have joined us. Good afternoon.
Good afternoon.
Good afternoon.
And a name, the Samaritans, that's, you know, we hear all the time, but maybe we don't actually get to know too much of the workings that's going on. Tell us a little bit about your roles in this, starting with you, David.
Well, I've been involved with Samaritans for about 10 years now as a volunteer, because everyone in the branch is a volunteer. And here in Liverpool, we're the second branch of Samaritans in England. So we've been around for just over 57 years. And, you know, listeners may have heard in the news recently about Alan, who's been with us for 57 years since the very beginning. He's just received his MBE. So myself and Rachel, we both take phone calls and emails and SMS from anyone who wants to get in touch with us, day or night. We're always there for people.
And what was the system like back then, 57 years ago?
Probably a little bit.
Not that you might know.
Yeah, a little bit before my time, but the branch started down in St Nick's Church on the waterfront, and we did have a telephone. The inaugural call came from Chad Varra, who set up Samaritans initially. Alan, who's still a volunteer today, was there on the very first overnight, so right from the beginning it was a 24-hour service. And I'm sure you'd agree, Rachel, how important that is.
Yeah, I think one of the interesting things at the moment, we're just trying to do, trace the history of the branch that David's been talking about. And a lot of the calls that were taken all those years ago, the issues around mental health were obviously very prevalent at that time as well. So it's quite interesting to look back all those years ago and see that those issues have always been around.
And obviously they're still there, and there's other issues to deal with. How did you get involved with the Samaritans?
I've been a volunteer for just under 3 years, so a baby really compared to some people in the branch. And it was just something that I became very interested in, and went along and just really quite inspired by, you know, the service, the way it looks after its volunteers, and the amount of support you get as a volunteer is amazing. And obviously just that connection with people, which is, you know, incredible.
People might say it's a brave step to go and volunteer. What was the feeling behind getting involved?
I just gone through some kind of bereavement in my own life. I lost my mum and my dad very, very quickly. And through that, just became more aware of support service that are available for people in Liverpool. And I'd always heard the name Samaritans, and predominantly I thought it was just something for people who were suicidal. I wasn't quite sure, you know, what the service was for. So I looked into it a bit more, went along to an information event and just took it from there, really. And
David, that might be a really good question. People might still think that. Well, but what is your kind of raison d'etre, or what's your the way that the Samaritans kind of sells itself now?
Well, a nice way to sum it up is that we are there for everyone, but it's not just about making cups of tea for everyone. It's, you know, we're there to listen at all hours of the day and night, be it by telephone, email, SMS, or face-to-face. And in the past, Samaritans had been very much linked to, say, feelings of suicide. But we're not just about that. We'd much rather people got in touch with us and started speaking about what they're feeling much earlier on in that journey. And I think also historically, because there's so much secrecy, or there was so much secrecy around the Samaritans, people were nervous to get in touch, and also seen it as a bit of a possibly a stigma around calling us, whereas there really isn't. And so many more people are coming out now and saying that they've been in touch with Samaritans, be it, you know, celebrities or people who have YouTube channels, or even volunteers themselves will come forward and say at one point they were in touch with Samaritans. And it's so rewarding when we hear from volunteers who are out fundraising that, you know, you see other charities and people put a few pennies in the bucket, but sometimes we've had stories that people have just come up and emptied their purses into the buckets and said that Samaritans saved their life. And I don't want to go around proclaiming that we're lifesavers, because that's not what we're about. We're there just to metaphorically hold someone's hand through the tough times, but really it's to facilitate people in finding their own way forward.
But you can be there at any time. It could be the moment when they are thinking that this is the end, or just the start of it when there's just some thoughts and they just need to talk to somebody?
Yeah, absolutely. And I think so many of us go about our daily lives, myself included, thinking that everything's okay. But you just never know when something might hit you. It could be a family member passes away, or the loss of a pet, even sometimes, or your loss of your job, or any kind of loss often can suddenly throw somebody into disarray that can quickly spiral into dark depths. And Samaritans can be there at that time for people to get in touch with.
And how was it when you first got involved, Rachel? What kind of welcome did you have? And you've got to have some training, obviously.
Yeah, I mean, the training is it's quite intensive, but it covers all aspects of what you'll go through as a volunteer, and there's a huge amount of support in the branch as well. And you do cover all different kinds of policies and procedures and what ifs. And then in Liverpool, what we do is we call it a skills practice. So all the volunteers will facilitate a telephone call, and it's kind of like a role play where you learn, how to speak to someone and how to listen. And then you become a mentee where you sit in with a more experienced volunteer, and then you shadow them, and then they'll sit in and shadow you. And then once you've gone through that process, you do a little bit more training, and then you become a probationer. So you don't just go in and start, taking phone calls. It is quite intensive, but all of that training is really needed because, you are there for some very difficult moments in people's lives. So it's important that you've, gone through all the processes.
And from a personal point of view, what have you got out of working for the service?
Obviously from the personal point of just being there for people, and it's quite an extraordinary, it's a privilege really when you think of, as David was saying, sometimes when you take a call and somebody might say to you, I've never told my wife or my husband how I'm really feeling, and it's just an opportunity for someone to offload. Other times, it's a more desperate situation where, you might have to get an ambulance involved for someone. And just really for me, it's the calls when people just might be just lonely, and they haven't spoken to somebody for a long time, maybe an elderly person, and it's just a conversation, and they're just, thankful that somebody's been there to listen to them and have a chat with them.
Because in that situation, you might think, well, I'm just wasting your time, but if they're having that conversation, they're using the service, that's what it's there for. Yeah.
And as David was saying, I think a lot of people feel it's just around suicidal calls, and that is obviously a huge part of what we do. But it's also been there for the vulnerable people as well in society who may live on their own, may not see people at all, for weeks sometimes.
And David, people like Rachel are so important, aren't they?
Absolutely. I mean, Rachel's amazing, as all the volunteers in the organisation.
And what kind of people are you looking to bring in? And can anyone get involved?
Anyone's welcome to volunteer in a whole range of different roles. It does take something quite special to be a listening volunteer, but there are roles there for everyone. So often people who come forward to volunteer at Samaritans may have had their own personal experience of using the service, or know somebody who's been affected in some way, or they may just have specialist skills that they want to offer, be it related to fundraising, IT, marketing and publicity, all of those things, because everyone at the organisation is a volunteer. We need all the normal skills that are required to run an organisation. So we'd be grateful to hear from anyone.
And you mentioned, I think, a couple of times, the different technology you've had to... It's not just the telephone anymore, is it? That's still the key part of what you do.
Yeah, absolutely. That remains a key part. And here in Liverpool, in our branch, we answer nearly 50,000 calls a year. And that's predominantly coming from Merseyside. It's shocking, and it's increased by more than 30% over the last 12 to 18 months, which is both worrying in itself, but it also shows the great need that we have for volunteers. So if somebody didn't feel able to commit the few hours a week that we require for the telephones, they are welcome to get involved in anything else that we'd find helpful.
I'm trying to do some quick maths about that, but that's a lot of calls every day, isn't it?
Yeah, it is.
And you mentioned you're dealing with different things now. Is it just more numbers that you're dealing with, or what kind of new types of calls are you getting?
I think since I've been involved, we are seeing an increase in the number of callers who are experiencing mental health problems. And obviously, with the kind of shortage in a lot of the mental health provision that people get, a lot of the time people are actually told by the CPN to call us over the weekends, if they haven't got access to a support worker. And I think those calls are increasing more and more, especially over the weekend. You'll see that. And we also, for example, take quite a lot of calls from prisoners, from people who are in prison who are allowed to call us, obviously struggling in their own way in that environment.
So many more different people to talk to, different stories to deal with and to cope with, and that, I suppose that changes the training that you do as well. You've got to be aware of everything that's happening.
Yeah, it's quite in-depth for training, and it can put people through a range of emotional experiences themselves, but also it's not all doom and gloom like it sounds. It can be quite fun at times because we do get a range of inappropriate calls, which keeps the training quite light. But yeah, everyone who goes on the phone or any other part of the organisation is fully trained. So because you're supporting people through the most difficult times of life, and you never know what's going to happen when you pick up that phone or welcome somebody to the branch to speak to us.
I imagine the support amongst the team as well is great to have. You must feel like a team.
Yes, and when you are on a call, there's always at least one other person who's on a shift with you, and we really encourage volunteers to kind of, once they've finished any call, really just have a conversation with who they're on shift with and have a chat about it, make sure the other person's okay. Or, as David said, if it's been a particularly unusual call, just have a chat about it and offload with the person that you're on shift with. That's really important, I think.
It is.
Radio City Talk. Tackling the stigma.
I've got David Ashton and Rachel Howley in from the Samaritans here on Merseyside. And we were just talking in the break there about new initiatives, David, that you've brought in, bringing in and going out and going face-to-face.
Yeah, which is a great step forward for the branch because not everyone feels able to go into a building to go and see someone, or indeed phoning up can be quite difficult. So on the first Wednesday of every month, we've got volunteers in the Brink on Parr Street in Liverpool between 12 and 2, where anyone from the public can drop in and meet our volunteers if they have something on their mind to talk about, or even just to find out more information about Samaritans, because we know that having that initial conversation can be quite difficult. So that's where we'll be on the first Wednesday of each month.
And actually getting out face-to-face, what kind of reaction have you had so far? Have you not been out yet?
Yeah, the volunteers were out last week, actually. We had a great reaction, and somebody actually said they wished that Samaritans had been there 20 years ago when they were needed, or when that person needed Samaritans. So it was great to get that kind of feedback and just have a few conversations with people, but obviously it's quite confidential, so can't go into too much info.
Of course, but just to get people talking to you and being face-to-face, I imagine, is vastly different from being on the phone.
Yes, I mean, we do offer drop-in in our branch as well, from 10 in the morning till 8 at night, and that's every day, every day of the year. And yeah, it's a different kind of contact with people when people come in and do a face-to-face, but I actually find it really rewarding to just to sit down and give someone some time. And again, that's all part of the training that you receive when you start.
Yeah, I don't think many people knew that. You could just... Can you just kind of ring up and book, or
you can just call
wander
in? Yeah, you can just call into our branch in Clarence Street, and we only have one available room, so it's not like a full suite of interview rooms or something, but yeah, people can call in any time. And
I think we've mentioned already, you need resources to do this. You need people, not just people to come and help you out, but you need people to continue to fund the really important work that you do.
Absolutely, because everyone hears Samaritans and they think that we're part of this big, wide organisation, which we work together with other Samaritans branches, but we are an independent organisation in our own right, and we currently don't receive any statutory funding. So all the money that we need to run an organisation comes from the kind donations of members of the public. So if anyone did feel they wanted to organise an event or take part in a race and fundraise on our behalf for the Liverpool branch Samaritans, we'd be ever so grateful.
Which, I mean, having said that you've got people directing people to call you from organisations, from kind of official sources to say, well, over the weekend, ring the Samaritans, it must feel a bit odd that there's no funding there that actually comes from statutory funding.
Yeah, I mean, I think a lot of voluntary organisations at the moment are, facing difficult times, and it's something that we just have to try and work around. And as David says, we have different fundraising activities that go on, but that's just makes the volunteering aspect of it so much more special. That people just give up the time and come and volunteer for us.
And you mentioned, of course, that not just at the Brink, but also out and about on the rail network as well.
Yeah, we want to be out and about in the community where people who really need us are, or indeed just where people are, because, we're there for everyone. So quite often we're at Liverpool Central Station. We're hoping to be at Liverpool Lime Street more often. And people can either find out more about us there or indeed have a chat. So we will approach people just to see how they are and if there's any way that we can help. Because often people don't feel able to make that initial conversation themselves, but we can walk up to people and see how they are and then take it from there. Also, A&E is somewhere that we're hoping to be within the next few months anyway. Volunteers will hopefully be in there in the evening times, possibly at the weekend. We're still finalising the details around that, but often people go to A&E for help. Well, obviously that's why it's there. But whilst waiting for the medical help, for whatever's physically happened to them or in other ways, we can be there and have a chat to them.
And the help on the rail network is seemingly having results.
It is. So that's been going for 7 years now between Samaritans and Network Rail, and there's a couple of other organisations involved. But in the rest of the world, people taking their own lives on the railway is going up, whereas in this country, it's the only country in the world where it's going down. And Network Rail have invested a lot of time in training their staff in how to approach people, and it can literally be as simple as going up to someone and saying, "Are you okay?" And so many Network Rail staff have intervened and saved a life, is a phrase that I like to use.
And interesting, it's the Network Rail staff as well. Have they learned to work together?
We work together really well. So although we don't have enough volunteers in Liverpool at the moment to be going out as often as what we like, there's some training taking place today actually at Railhouse, where the Network Rail staff will find out more about Samaritans, how to approach people, and then if they do find someone who's in distress, to make contact with Samaritans. And indeed, people have probably noticed our signs at the end of every platform, where it's got our number, which is 116 123. It's there for people to give us a call.
And Rachel, if someone's out there who is thinking of joining you and getting involved in volunteering, what would you say to them?
Oh, definitely. It's something that I think once you try it, it just becomes a part of your life. And it is so rewarding, not just being part of the team in general, but what you get back from helping people is amazing.
And what sort of people are you looking for?
Anyone who has the time to give and the skills to listen to other people and to listen attentively and support them through difficult times.
Because I imagine not everybody makes it through the training, or obviously you support them as much as you can, but it does take a certain ear, doesn't it?
It does, and the training's really in-depth, and it gives people a lot of time and opportunity to develop, but some people make the decision themselves that's perhaps not for them. And often it's because people haven't really thought through what it might actually be like to be on the phone to somebody who's experienced such despair at that particular point in time. But that's not to say they couldn't volunteer with Samaritans, because they could help with fundraising or publicity or anything else that they've got the appropriate skills to help out with.
So if they want to get in touch and get involved, more importantly, how do they do that?
So the quickest way would be just to head to our website, which is samaritans.org, and just click volunteer with us. And the phone number is also on the website. I'll give you that in a second. Indeed, if people wanted to call us for emotional support, they just need to ring 116 123, which is a free phone number, and you can ring it from any phone, even if you've got no credit on your mobile. But if you were looking to help and, say, for example, you haven't got internet access, you can phone us on 03705 627 282, and someone will be able to take your details and get back to you.
Excellent. Well, thank you for all your work.
Thank you.
And you must have had you've been working Christmas days, or have you?
Yeah, and that's one of my particular favourite shifts, actually. I do Christmas night overnight, so that's 10 of the night until 4 o'clock in the morning. I do that every Christmas for the last 4 years. And again, that's predominantly for people who Christmas can be a great time for lots of people, but a very hard time for other people as well. So, yeah.
And any time, I imagine, we do get the stories on the news, any time when families, strangely, meant to be together, except we're in Easter week is another one where families come together, is a time when people who aren't with their family or feeling lonely in any way, it must increase your calls, and you must have to deal with that as well.
It does, and particularly New Year's Day as well. Calls just go through the roof, so to speak. So people are always welcome to get in touch with us at any time, day or night. And the great thing about being part of a wider organisation is when volunteers go away over Christmas and Easter, they can volunteer elsewhere too.
Brilliant. Well, so good to speak to you. Thank you for coming in, and thank you for the work that you do. David Ashton and Rachel Howley here on Radio City Talk. This is Liverpool Live.
Mental Health Monday on Radio City Talk. Tackling the stigma.